Good morning. My name is Janet Thurston, and this is my presentation for the final teaching project assignment for the course PC 711 Nurses Educator. This teaching assignment will direct towards electronic health education, basic clinical ambulatory EHR education. My capstone is an investigation of NP, or Nurse Practitioner, CNM, Certified Nurse Midwife, EHR utilization satisfaction. This presentation will provide you with information on an educational methodology needed to enhance NP, CNM, EHR use in practice. The outline for today's presentation on ambulatory EHR education will review the following: a description of the learner, the needs assessment, learner goals and objectives, a teaching content outline, the method of instruction, evaluations, resources available, and a summarize at the conclusion of the presentation. Who are the learners, nurse practitioners and nurse midwives? Why is this important? Many of these providers are practicing independently in owned and operated birth centers or primary care settings. They particularly may need more support to adopt EHR use, where training is critical. The Center for Medicare and Medicaid Services has a program titled Meaningful Use, which is related to adopting EHRs in practice, with financial incentives which help offset costs of adopting EHRs into practice. Nurse practitioners and nurse midwives are eligible providers as Medicaid providers. The EHR adoption is complex, and the more education that is appropriate is most helpful. The clinical problem can be to notice the growing use of EHRs in practice, and there are many barriers. One of these, according to the literature, is lack of training and/or poor clinical training design. The growing use of EHRs is done to increase patient safety. Also, there is the growing use of meaningful use, or the Center for Medicaid and Medicare Services Requirements, which is a government federally funded program requiring EHR changes. The barriers that are occurring include financial risks. There are settings that are not ready for these changes. And again, the poor training is a barrier to implementation. To begin to consider how to address the clinical problem begins with the needs assessment. Why do we need to examine learning needs for EHR education? The literature has clearly identified that EHR adoption is tied to patient safety, and that the utilization of electronic health records in ambulatory practice has grown. Effective training is necessary for successful EHR implementation, and providers will need training to be able to meet the basic competencies and the clinical expectations in utilization. And this education will support the safe practice. If a clinician makes the decision to proceed with EHR adoption, a clinical site needs assessment is the first step prior to education. This is identifying organizational cultural needs. Organizational needs and readiness assessment precedes EHR education projects to ensure that there is a strong financial, cultural, and organizational ability to support this change. Clinical provider champions of change then emerge to help strengthen the educational teaching projects, such as the one I present to you today. According to the literature, EHR implementation increased from 14% to 78% for ambulatory physician offices between 2001 and 2013. Data on independently owned and operated birth centers or nurse practitioner practices is not available. And despite all these efforts made, when training is poor It leads to decreased productivity and dissatisfaction in the work setting. These are often causes for implementation failures. How do organizations or providers know when they are ready for EHR training or for EHR implementation? The training solutions have been identified. All stakeholders must agree to the need. For this educational project, nurse practitioners and nurse midwives must participate in this needs assessment. They must be at the table for decision making. Organizational readiness is present. The clinical staff must buy into this process of change. And organizational readiness must be determined. Then the next phases of EHR training can begin. The purpose and goal of training providers is to ensure utilization of it will be effective and meet the goals of patient safety and improved care. The care we provide must be safe, efficient, effective, and record security that is maintained. That is one of the primary reasons patients can achieve satisfaction in utilization of an EHR. There are 3 learning objectives in this teaching project. The first is EHR access, which is accessing the chart where and when it is needed. The second is clinical provider order entry, or CPOE training. That refers to learning how to use the EHR when providing orders. The clinical decision support system is a component of the EHR system that supports decision-making to enhance safety. Providers will learn how to access the chart information and navigate it. They will gain competence in using the CPOE and understanding the clinical decision support system. The training time utilized is following adult learning theories of the flipped classroom. Self-directed learning allows the learner clinician to fit these training schedules into their schedule initially. The classroom time that follows this is hands-on experience with peer support. After the go-live or initial day of EHR use, this training extends with peer support at the clinical site. These 3 training phases are followed by learning measurements created, such as competency quiz and performance checklists completed. The teaching content outline described is outlined on this slide for Objective 1. Objective 1 is EHR access. That will mean in outlining content, accessing the EHR chart. That will be looking at the portal, obtaining and utilizing your password, and learning the menu of the system. The method of instruction will have 3 phases. The first is self-directed e-learning, which may be done in 2 hours over self-scheduled time prior to classroom. And during this time you may have a pre-test, post-test quiz done online as a method of evaluation. The second phase will be a classroom group work computer demonstration that is usually interactive and may be done over 40 hours with a day or evening scheduled time in a classroom where there is an EHR trainer. Usually this will involve a clinical provider who trains other providers. It is live and you will be demonstrating your competence in EHR training. During this time you'll have usually competency checklists to be able to demonstrate your ability to pass all the competencies involved in accessing the EHR chart, in navigating through it. The third phase of on-site champion support will occur in your practice during the first 2 weeks from the go-live date through the first 2 weeks of utilizing it in practice. Usually there is a clinical champion liaison who will help you on site. During this time, you'll have an 80% passing rate at a completion of the program, and this involves a competency checklist during the time of training. This is the teaching content outline for Objective 2, CPOE training, which is usually, again, vendor-based, depending on what EHR system you buy. The outline content is for the CPOE training. And again, the method of instruction will have 3 phases. The first is self-directed e-learning, which you will do on your own with 2 hours scheduled. You do online. There may be pre-test, post-test quizzes that you'll do as a method of evaluation to demonstrate your own competence at the online learning. This is followed by classroom, group work, computer demo, and this may take 40 hours of day or evening scheduled time in a classroom, again where there is an EHR trainer who is usually a clinician training other clinicians. During this time you'll have live demonstrations which you repeat competence through a competency checklist with the EHR trainer. During the third phase of training, it is done on-site in your practice with the champion support person clinician from your go-live date during the first 2 weeks of utilization. The clinical champion liaison will help you through utilization, and there may be again a competency checklist where you will show 80% passing rate at completion of the program. These links can demonstrate training, and I encourage you to examine them via the BBS posting. They cannot be accessed through the podcast, however, can be accessed through PowerPoint slides posted. If you click on the CPO training materials above, this provides examples of what can be utilized in the flipped classroom of training. These are being given to providers in many practice settings, and see the list below. The teaching content outline for Objective 3 is CDSS training. Again, the outline content has 3 phases of training. First, the self-directed e-learning, which occurs over 2 hours of self-scheduled time online with pre-test, post-test quizzes that occur online during this phase. It is followed by classroom, group work, which is done in a classroom with an EHR trainer, a clinician who trains other clinicians. This occurs over 40 hours of day or evening scheduled time in a live competency checklist is the method of evaluation done with the EHR training. This is followed by on-site, go-live, champion support in the clinical setting for the first 2 weeks in practice. The clinical champion liaison contact person will help you pass the competency checklist in practice with an 80% passing rate. During this time, you will learn to have clinical functionality in use of the EHR, and it will introduce you to utilizing the system with charting orders. The CDSS system has the coverage of utilizing functionality in practice with the safety mechanism backup system. Again, this is a link to an excellent brief explanation of the CDSS, which is extremely encouraging, as to listen to a leader explaining what benefit they have. These types of links provide motivation to the learner that can be beneficial to face the challenges of change, which many providers face, which is immense. The link is provided below. This is the Clinical Decision Support